Hi everybody, my name is Marissa Wilson and my special topics presentation is on Heaves and COPD in horses. So what is Heaves and COPD? COPD stands for chronic obstructive pulmonary disease and is now commonly referred to recurrent airway obstruction. RAO or Heaves is a common respiratory problem that is characterized by the airway in horses narrowing, mucus production, and bronchospasms. Horses with Heaves will usually have an increased respiratory rate or a cough. It is a chronic disease that will require lifelong maintenance and management for changes in owners. So there are two forms of RAO that can be recognized in the horse. Barn-associated, which is where antigens, which we will talk about in the next slide, can enter the microenvironment such as the horse's stall, or through the macroenvironment such as the whole barn, when new feed and bedding is being placed. The second form is the summer pasture-associated obstructive pulmonary disease, or SPAOPD, and is commonly referred to as summer Heaves. This is more common in horses living on pasture in the southeast region of the United States. So, what are the causes of Heaves and COPD in horses? Most evidence shows that RAO is a result of the lungs' hypersensitivity to inhaled antigens, such as fungi, dust, endotoxins, and mold. Bacterial fungal contamination of hay is dependent on plant physiology status, the weather conditions, harvest conditions, and the speed and stabilization of storage. The antigens that I previously mentioned can also be referred to as stable dust. There's non-respirable, which are particles larger than 10 millimeters, and respirable, large or small. Large particles may vary between 5 and 10 millimeters, and they often include plant structures, large pollen grains, and fair weather spores. And the small respirable particles are anywhere between 0.1 and 5 millimeters, and it usually contains the dust that holds mold, bacteria spores, mite feces, and endotoxins. So, what causes these antigens in the small particles? Poor cured hay and harvest of bedding. As I previously stated, the small respirable particles contain different fungal species and spores in some hay, straw, and shavings that our horses can eat and bed on. The small particles can be found in poorly cured hay that continues to heat during storage where certain fungi can thrive. Studies have shown that both straw and shavings had a similar component of mold as contaminated hay did. So if you notice that your bedding may be spreading unwanted dust, consider switching to a better quality such as wheat or flax straw, because these types have been proven to have fewer respirable particles and allergenic spores than in your common wood shavings. Even pelleted newspaper can be a great alternative to straw or shavings. So, which horses are likely to experience COPD and Heaves? Well, this is a disease that can occur worldwide, but we do see the highest prevalence in horses that are stalled and fed hay, mostly in the northeastern and midwestern areas of the United States. There has been discussion about genetic predisposition, but it has not really been identified as a genetic condition. I will say that if both parents do have COPD, the offspring is more likely to develop it. Age, it usually happens between the years of 9 and 12. There's no distinct breed that develops this over another, and no distinct gender of a horse that will develop this over one or another. So if you believe that your horse is coming down with COPD, what should you look for? Your horse might present with a chronic cough, white nasal discharge that is in the top picture, and experience some exercise intolerance along with breathing difficulty, and they will also show a heave line, which is located in the bottom picture. This heave line is exposed when hypertrophy in the abdominal muscles occur because they are assisting with breathing and become large due to their excessive work. You can diagnose this disease through your local veterinarian through a clinical exam. Additional tests can be performed also: an upper airway and tracheal endoscopy, a bronchoalveolar lavage, which is usually used in horses that are exhibiting poor performance and the chronic cough, a lung function test. Thoracic radiographs are recommended for horses that fail to respond to any other standard therapy, and to see further information in the lungs, and finally an ultrasound examination can be done. So treatment for Heaves can include management, dietary, and medication, so we'll quickly go through these. If you have a horse that is diagnosed with RAO or Heaves, you should most likely move a horse when you're changing their bedding. That way the dust particles cannot be inhaled. Avoid storing hay above the stalls so that they can, so when you move your bale, it is not dropping down any dust so they can inhale. Avoid seeping floors when these more prone RAO horses are in their stalls. Use low dust bedding. Wash stalls regularly. Make sure your facility has adequate ventilation. And turning out horses prone to RAO can result in asymptomatic horses within the first 4 to 6 days after turnout. They also showed improvement of respiratory function after 3 days of turnout. The dietary treatment you can use is use dust and mold-free feed and forages. You can find this out by microbial analysis. Moisten feeds through steaming or soaking. Steaming feeds is alternate to soaking. Steaming by 80 minutes in 5 kilogram hay nets and plastic dustbins can reduce the ARPs by 95%. It conserves minerals and protein quantity in hay, and the hay gain steamers have been shown to maintain low dust status of post-steam forage up to 4 days. Soaking reduces the number of airborne respirable particles. It can increase bacterial concentration and should be fed immediately. Wet hay nets should not be left in stalls more than 2 hours because viable bacteria will thrive and produce spores, and then that will quickly deteriorate the nutrient and hygienic quality of the hay. One thing to note about steaming versus soaking is that steaming tends to hold crude protein and it does not eliminate any other value to other nutrients, whereas soaking does. So what's better, steaming or soaking? Just as I kind of stated in the previous slide, soaking in 30 liters of cold water for 10 minutes and steaming in the HG 600 reduced ARP numbers by 99%. Steaming in the hay gain 600 reduced mold and bacterial concentrations by 99%, and steaming in the high gain 1000 steamer showed no reduction in nutrient content between dry and steamed hay. The only nutrient that tended to decrease was water-soluble carbohydrates. So overall, steaming hays in high temperature conserve the mineral and crude protein contents while being the most effective method for reducing ARP and viable microbial numbers. So if you do have a horse that has COPD, consider steaming the hay. So if it does reduce those particles, but they can still get the full nutrient effects. And finally, medications can be a treatment. Things such as corticosteroids. These are the most common and can be very effective because the way they counteract the inflammation within the horse's lower air passage. Within 5 minutes, their functional breathing is improved to 70%. Dosage levels are intended to keep small because too much can promote laminitis, but a downfall to corticosteroids is they only assist with the horse in their heaves for 1 to 3 hours. Bronchodilators are also similar to corticosteroids, and they assist in the horse in opening up the restricted airway that heaves and inflames. They do work, but they're not the best form of therapy because they don't get to the root of the problem without making any other changes to the horse's maintenance and environment. So what are some others? Antihistamines can be used, but there's no evidence they're effective. Immunostimulants and NSAIDs also appear to have little effectiveness. Antibiotics should and can only be used when a concurrent infection is in place with Heaves. Cough suppressants should not be used because horses with Heaves constantly cough to remove the mucus from their airway in hopes to clear it. There is supplements that you can add into the horse's feed that tend to say they help clear mucus, open up airway, and help with their cough. So, can these horses that have COPD still be ridden? Yes, of course, but only if they're managed correctly. If horses are managed correctly, for their Heaves, RAO, and COPD, then they can still excel in trail riding, pleasure, and maybe even performance if the owner is very committed. Those are the sources. Thank you for listening, and I hope you learned something.